to Coast Mountain School District and the Northern Health Authority's Town Hall. Thank you for joining us this evening. My name is Janet Meyer, and I'm the Superintendent of Schools for Coast Mountain School District. I'd like to acknowledge this evening that we are conducting the business of Northern Health as well as the Coast Mountain School District on the traditional territory of the Shincham people. We're honored to work, live, and play on this territory, and we're honored to serve the needs and the students of this territory. So good evening, and again, thank you for joining us. I'd like to take the opportunity to introduce you to our guests or our partners this evening. And I'd like to start with Dr. Raina Fumerton, who is our medical health officer, as well as Patrina Bryant, who's joining us this evening from Quesnel. Patrina is the regional nursing lead, specifically her portfolio deals with healthy schools and youth. And you will be hearing from both Patrina and Dr. Fumerton in a few short minutes. Prior to that, however, I would like to introduce you to the Board of Education for Coast Mountain School District's Board Chair, Ms. Shar McCrory. And I'll turn it over to Ms. McCrory, or Board Chair McCrory, for some introductory comments.
Good evening, everyone, and welcome to our town hall meeting with our partnership with Northern Health. I would just like to briefly say that safety of our students and our staff is our #1 concern. And we want to ensure that we communicate to everyone involved, including parents, partners, students, staff, and leadership, that this is our #1 area of priority, and that we work very closely with Northern Health to ensure that we can maintain that safety as our priority. I would also like to say that it's essential that we all work together through this pandemic to ensure the safety of everyone. And I appreciate the patience and understanding of all of us for moving forward in this difficult new time for us. Our communities are doing amazing jobs in trying to maintain safety as we move forward with our kids in school and supporting them in every way that we can. Our goal is to continue to support our students to optimize their learning and to ensure that everyone is safe in doing so. And with that, I'd like to thank Northern Health for supporting us through our journey and to turn it over to Dr. Fumerton and Patrina for their presentation on COVID-19. Thank you.
Thank you so much for the introduction, and really grateful to be here this evening. My name is Raina Fumerton. I'm a public health physician. I'm a public health and preventive medicine specialist, and I've been working at Northern Health for about 6 years now. Currently, I'm covering the Northwest Health Service Delivery area of Northern Health, as well as the Northeast Health Service Delivery area. And I'm just going to ask Patrina Bryant to introduce herself before we begin.
Hi, everyone. My name is Patrina Bryant, and I'm the Regional Nursing Lead for Healthy Schools and Youth. And I work in the public health practice team with Northern Health, and I've been with Northern Health for 25 years now. And this past spring, I was doing contact tracing and case management for people that have COVID. So I do have experience in that setting as well.
My apologies, I can hear my son doing piano practice upstairs. I've just asked that that be stopped momentarily. So sorry if you hear some background noise. So just to set the stage here, what Patrina and I have done, and hopefully it's useful to you, is to just provide a bit of a presentation, which hopefully will serve the purpose of answering some questions and curiosities that many of you may have. We've also received some specific questions from those who are stakeholders in the school district, parents, teachers, etc. So we've got a list of questions that were derived from that process that we will endeavor to answer. And then we thought that we would also add, we've done a few of these types of town hall sessions, so we thought we'd also add a few additional questions from other school districts in case they were hopefully of relevance and of interest to you all as well. And if there are any outstanding questions resulting from this session, then feel free to email, would it be yourself, Janet, any questions, and we can collectively endeavor to ensure that those questions are answered.
Absolutely, Dr. Fulmerton. So we have shared the questions that we received in advance, and there are, I believe, 2 that I will try and find an opportunity in our next 45 minutes to respond to as well. But additionally, on YouTube, where we're going live, there's a chat feature, and people are welcome throughout the course of our 45 minutes together to put questions in the YouTube chat. And as we did for our first town hall, we will respond to those questions in the next several days, updating our frequently asked questions template on our on our website. So while we won't be able to answer the YouTube questions tonight, we will get to them in the next few days.
Great. Okay. Thanks for clarifying the process for that, Janet. So I will begin. Katrina and I are going to go a bit back and forth in terms of the slides. So Janet, if you don't mind moving us to the next slide. Yeah, that's the one. So you'll see what we call EPI curves. There it stands for epidemiologic curves for the province as a whole, and then for Northern Health. So it might be a little bit hard to see. Obviously, the scales of the graphs are different to one another because the population of the North is quite a bit smaller than that of the province. But just to give you an overall trend in terms of what these graphs depict are the new cases of COVID-19 detected since the start of the pandemic. For the province, it's on the left, it's the blue, and on the right, you'll see the cases for Northern Health Authority in green on the right. So basically, this is just showing you the trend of our caseload since the beginning of the pandemic. We're seeing more cases, and you can see all of this on the public BC Centre for Disease Control dashboard, and we've provided a link to that resource on the slide here. So we are seeing more cases now than we did in the first wave, provincially and within Northern Health. Part of that is because we're testing a lot more. Initially, when the pandemic began, we really had to narrow our testing down to the highest risk populations. And since capacity has opened up, we've been enabled to have a more permissive approach. So we have been doing a lot more testing. At the same time, that doesn't totally explain the rise in cases. Part of it is just simply because we have more cases, and we're entering the fall respiratory season, and people moving indoors, et cetera, where we know the higher risk of transmission occurs. So hospitalizations have increased somewhat provincially, but they're still lower than they were in March and April. And in the North, our hospitalization rate has actually been low throughout the pandemic and continues to be very low. What we've certainly learned in the last 11 months since the pandemic was declared is that this is a virus that is with us for the long term. We're not going to be able to eradicate COVID-19, and we need to learn to continue to live with it, possibly for years to come. So we have to expect that cases will continue to happen, but we manage that risk when it arises in each and every one of our communities. And we have a lot of experience now, both in BC and from around the world, showing that schools are not high-risk locations of transmission. We do need to take precautions, including contact tracing, but we know that in the vast majority of cases, the combination of effective infection control practices in the school, coupled with contact tracing by public health experts, is sufficient to, in the vast majority of cases, to stop transmission in schools. Katrina Bryant, who introduced herself earlier, is our Healthy Schools lead, has also worked as part of the contact tracing team for several months. And so, Janet, if you don't mind moving us to the next slide, Katrina will walk us through what that process looks like. Thanks, Katrina.
Thank you, Raina. So contact tracing in schools. So this is a really good algorithm from the BC CDC's COVID-19 public health guidance for the K-12 school setting. So it's Appendix B in that guidance document. And it provides a good snapshot of the contact tracing process. And public health follows the BCC provincial guidelines to follow up with people confirmed to have COVID-19 and their close contacts. So over the next few slides, I'll explain the contact tracing process in greater detail, but I did want to provide that algorithm for you. So public health follow-up with confirmed cases. So public health contacts the case to discuss what symptoms the person is experiencing and to find out when the symptoms started. They'll look to see where they might have acquired the infection, who they were in close contact with while they were infectious. They'll be advised to self-isolate for 10 days from when their symptoms first began. And then public health will answer any questions the person may have, provide some education and some guidance. And then from there, public health checks in daily to monitor the person's health and needs. And when 10 days have passed and if the symptoms have improved, then they can end their self-isolation and return to normal activities. So we'll just look at the next slide, please. So confirm close contacts. Public health identifies and notifies the close contacts. And this is based on the prolonged time spent in close proximity with another person. If it's face-to-face contact, if there were no masks worn, and public health will look to see if there's any direct contact with infectious body fluids. And just to note that most contacts at the school do not meet these criteria. And close contacts will be advised to self-isolate for 14 days from the last date of exposure. So this means that they can't have contact with others. They can't be attending school or going to work or going out to the public and out shopping. So really they shouldn't be leaving their home and they shouldn't be having visitors into their home to visit them. Public health will call daily to monitor the person for COVID symptoms. If symptoms develop, then they are referred to for testing. When 14 days have passed and no symptoms have developed, then they can end their self-isolation and return to normal activities. So collaboration with school and health leaders. So when contact tracing finds that a case was infectious while at the school or infected at school, public health notifies leadership. So they'll notify the school principal and the superintendent. If there happens to be a case in a First Nations school, First Nations Health Authority is notified and they notify their health director and political leaders. And public health will identify and notify close contacts at the school. So they may request a student or staff contact list if needed. They'll identify close contacts and advise them to self-isolate and monitor for symptoms for 14 days. And most people will not need to self-isolate, get tested, or do anything out of the ordinary. And I'll just hand it over to Raina for the next slide.
Thanks, Katrina. So Janet, if you could go to the next slide titled Experience to Date. So in general, I'm speaking to the experience in BC to date. We know that COVID cases are happening in schools, but that transmission beyond a few close contacts is rare. Katrina outlined what the definition of a close contact would be for public health contact tracing purposes. Large outbreaks in schools have been very rare, and when schools have a solid safety plan with good infection control measures in place, combined with the public health contact tracing that Northern Health provides in the event of a case, the transmission in schools dies out very quickly. On the other hand, rumors and misinformation can spread very, very quickly, and in some ways that's been one of our biggest challenges. I can speak to our experience specifically in the North. We've had several scenarios in the North now of school exposures, and those are all posted publicly on our Northern Health website. The vast majority of the time, it's children who've attended school during their infectious period. And largely this is because the infectious period includes 2 days before symptom onset. So you have children who are asymptomatic and they obviously would have no idea they're going to develop symptoms. But technically and theoretically, we know that COVID can spread, although it's thought to be a much lesser risk period in the 2 days prior to symptom onset. And that's why we, out of abundance of precaution, go back that 48 hours. So it's, by and large, people are taking this very seriously and being very responsible, but of course you don't know what you don't know. So if you don't know you're going to develop symptoms, you wouldn't know to stay home from school. So, again, most of our scenarios, the quote unquote exposure is due to a child who has attended school during their pre-symptomatic phase, which is a lower risk phase of the illness in terms of the infectiousness, because they're not coughing, they're not sneezing all over everybody, etc. And thus far, we haven't seen any secondary transmission from children to other children within the school setting in the North, to other classmates or teachers in the North. On occasion, scenarios, and again, it goes back to just assessing the risk and then addressing the safety plan. Sometimes if the break room is too small, or the lunchroom, etc., then there's been a little bit of transmission amongst staff, but again, it's been very quickly addressed by just addressing infection control measures as they arise, and then with good solid contact tracing. So we've actually done very well to date in the North in terms of schools, and we know how important schools are for the health and well-being and development of children. So I'll just move you now, Janet, to the next slide titled Confirmed Cases versus Clusters, because I know there's a lot of questions about that. Next slide. Oh, are we missing? It should be slide 9, Janet, titled Confirmed Cases versus Clusters.
She might not have that right now. Slide 9.
Okay. My apologies. Maybe we didn't send you the most up-to-date slide deck, Janet. But I'll just, you can leave it at experience to date, and I'll just speak to this slide and make sure I cover all the content, and we can send you an updated slide deck after this session. But all of this mystery slide was speaking to was, so what's the definition of a confirmed case, and what's the definition of a cluster? What are you going to do about it? So a confirmed case is a person who is a laboratory confirmed case of COVID-19. And this test would need to be done at a lab accredited site. So usually this is at a community or a hospital or reference laboratory that these specimens are processed. At the moment, we currently are primarily using nasopharyngeal swabs for adult population, and we also have the option of, and for young children, and then we also have the option of the saline gargle for school-aged children. So that's the definition of a confirmed case. A cluster would be defined as multiple confirmed and linked cases of COVID-19 among students and or staff within a 14-day period. 14 days is the incubation period of COVID-19. And so the determination of a cluster is made by the medical health officer, so someone like myself. So in terms of what do we do about these situations, or what will we do about these situations? Let's start with the example of the confirmed case. And we've had many of these so far. So for a confirmed case who is in a school environment, so they need to have actually been in the school environment at some point during their infectious period. And as I explained earlier, this includes 2 days prior to symptom onset. So if there's an event such as this, we notify the superintendent of the school district, and we notify the principal, and a letter gets sent home. The letter basically states that we've had, that there has been an exposure event or an exposure in the school environment. Thus far, we've been very happy to be able to say in our letters that the risk is very low because the school safety plan has been followed, and unless public health contacts you directly, there's no additional measures that need to be taken. You don't have to do anything because you've read this letter, but just so you're aware, and just so everyone is maybe more attuned to being very careful about monitoring themselves for symptoms and their children for symptoms. As stated, usually that's it. And then we don't see any further transmission related to the school environment, and public health does the contact tracing and tries to figure out who the close contacts are, and then we isolate them. And yeah, and usually that's that we don't see any further transmission. In terms of a cluster, and I've given the definition for that, and what we would do is basically, it's not necessarily a black and white answer that I can give you. It's complicated in that the actions that we would take by the school district and the school and public health are based on a risk assessment. So every scenario is different. So I'll just, as an example, to sort of convey the nuances, which I'm sure wouldn't be surprising to any of you. You know, so looking at the situation, so say we had 3 or 4 children who end up with COVID-19. Do we believe the exposure occurred within the school environment itself, or was the additional transmission event more likely due to some socializing and spending time together, close contact outside of the school environment, for example? So that so depending on the scenario, we would consider what actions would actually be the most effective. Given children are big spreaders of COVID-19, and given the very robust safety plans in place, and the experience thus far in that schools are not a big source of transmission, you know, it would be a very you know, significant situation if we actually had to go to an extreme of like closing down a school, or even sending home an entire classroom. We know how important it is for the health and well-being and development of children for them to be in school, and so we would be taking a decision like that very seriously, and the risk would need to be proportionate to that decision, if that makes sense. So again, some specific risks of the specific scenario may be identified through conversations with the school, and perhaps enhanced cleaning measures in certain areas would be required. Obviously, public health will be doing their job of ensuring cases and their close contacts are isolating for the required time period and supporting those who develop symptoms to get tested. And all of that is really, really important. So hopefully that gives a bit of a sense of the decision-making process and the thinking that goes along with these scenarios. And again, there's a risk assessment done in each and every scenario. So the next slide that I have here would be that's the one, Janet. So this would be, I'll hand it over to you, Katrina. Thanks.
Okay, thank you, Raina. So this is the Northern Health Public Exposures and Outbreaks webpage. And on this page, there is a section for COVID-19 school exposures where that gray arrow is. And if you click on that tab, it opens up where you can see the school exposure information listed on the right there. So that's just a little snapshot of what that site looks like. And like Raina mentioned earlier, if there is a potential COVID exposure in a school, then we do send that letter, and it's shared with the school community by the school principal. And then we post it on this Northern Health site. So these are some exposures that have taken place in the north. And we'll go to the next slide, please, Janet. Okay, so this is the Northern Health School and Youth Health webpage, and I wanted to share this with you because there are a lot of great topics here with a lot of great resources. So if you're on the northernhealth.ca website and you search School and Youth Health, this page will come up for you. Even if you just search schools, it will come up. So each tab on the right opens up where you can see a list of resources under each topic. And then our Healthy Schools email address is also there if anyone wants to contact us. healthyschools@northernhealth.ca. And then on the list of topics there, the second one on the right is a back to school tab. So the next slide, Janet, I'll get to go there. So I've expanded that back to school tab just so everyone can see all the resources listed under that tab. So there are a lot of resources to support schools, students, and their families during the COVID-19 pandemic. And there's resources from BC, Doctors of BC, Boundary, and supports for mental health and well-being. And at the bottom there, under the World Health Organization, there is a really good children's storybook that I wanted to point out. So it's a storybook to help children and young people cope with COVID-19. So now I'm going to hand it back to Raina, and we'll look at our questions.
Great, thanks. So thanks. This is the first question that we received from School District 82, and I just want to thank those of you who provided these questions. They're excellent questions and really thoughtful questions, and hopefully our answers provide some useful information here. So perhaps I'll just read the question out and then provide our answers. And then if there are still outstanding concerns or questions, as mentioned, there's a process to forward those along to us through through the YouTube platform. So question one, Dr. Tam and the Public Health Agency of Canada has recently revised its guidelines to add aerosols as a route of transmission for SARS-CoV-2 virus. Because of this, hand hygiene and physical distancing are no longer considered to be enough to prevent the spread of COVID-19, and as these measures are primarily helpful for large droplet transmission, but are not considered to be enough for aerosol transmission. As such, I would like to know if contact tracing for a confirmed COVID-19 case in a classroom will be extended to include all children in the same class and or cohort, and not just students who sit in close proximity to the infected person, to take into account aerosol transmission. So thank you for that question. So certainly, I would say that good hand hygiene and physical distancing are actually still critically important infection control measures to help prevent the spread of COVID-19. The contact tracing that public health is currently doing is effective to limit the spread of COVID-19. Nothing is 100% perfect or 100% risk-free, but it's not necessary to do contact tracing beyond the people who would be considered close contacts as per the BC Center for Disease Control definition of a close contact of a confirmed case. And it's also, and our experience to date has shown this, and it's not like you can't find an exception to every rule, but we have found that it's not necessary to ask an entire class or a cohort to self-isolate when the risk is low. And as mentioned, we do send out the letter every time there's a school exposure. So our hope is that we've been very transparent that there's been a case that's been at the school during their communicable period, and we do emphasize in the letter for everyone at the school to be more cognizant of self-monitoring for symptoms and to get tested if symptoms do develop, because that's really when the infectivity potential goes up. So in the school settings, close contacts, and Katrina, I believe, went through this, are those with a specific history of close, prolonged face-to-face interactions or body fluid contact beyond what would be usual for the average person in the classroom setting. And you know, as mentioned, we're confident that this is sufficient, and again, balancing the harms of taking disproportionate measures to the risk. Our experience to date in BC and in other jurisdictions, when we have similarly strong safety plans in schools and relatively low transmission rates in the community, which is the main driver of when you'll see cases in schools, is what's actually happening in the community. And we found that transmission from students to other cohort members who are not meeting the definition of close contacts has been very rare provincially. The difference in risk between the non-close school contacts with the same cohort and anyone else in the school setting outside of the cohort is negligible in most cases. So I'm going to pass it to Katrina to answer the second question that we received. Thanks, Katrina.
Thank you. This was another great question, so I'm going to read it out to start with. The new guidance from the Public Health Agency of Canada states that SARS-CoV-2 can spread from an infected person to others through respiratory droplets and aerosols that are created when an infected person coughs, sneezes, sings, shouts, or talks. Because there is an increased chance of transmission during these scenarios, will Northern Health and Coast Mountain School District 82 change its recommendations for the use of masks and increased ventilation for higher risk situations such as music class, when all kids are singing in a closed space, or for teachers who are talking for a prolonged period of time to students in a closed classroom, or for children who are excited and talking to their friends in the mudroom before and after recess? So Northern Health follows the provincial COVID-19 public health guidance for K-12 schools. And as we learn more about the virus, the provincial guidelines are updated to reflect current recommendations when that's needed. So Dr. Henry is continuously reviewing what's going on in our province and will change recommendations when it's necessary. On November 5th, so just last week, the Public Health Agency of Canada recently provided an update to include aerosols, which says that the droplets vary in size from large droplets that fall to the ground rapidly, so within seconds or minutes near the infected person, to smaller droplets, sometimes called aerosols, which linger in the air under some circumstances. So the relative infectiousness of droplets of different sizes is not clear. And it is still the case that most transmission is not by aerosols, and the measures we know to be effective are still effective because they have been studied for COVID-19 specifically, and COVID hasn't changed. So we know that existing safety plans that have been sufficient to keep the risk of transmission low in schools, even for this pathogen that all along has been vocationally transmitted by aerosol. And I commend the plans that were put in place by our school districts in the north and schools. And following these plans are doing a good job of protecting staff and students at the school. And under the current health and safety guidelines, masks are required for all staff and students in middle and secondary school when they are in high traffic areas. So places like school buses or crowded hallways, and anytime they are outside of their classroom or their reading room, they can't safely physical distance from each other. So students have the choice to wear a mask in the classroom, and staff have the choice to wear a mask when interacting within their learning group. Everyone must treat each other and those wearing masks with respect, and exceptions can be made for students and staff who can't wear masks for medical reasons or disability reasons. So elementary school students currently are not required to wear masks. And even when wearing a mask, staff and students are still required to maintain physical distance from people outside their learning group where possible. And if a student or staff member develops symptoms while at school, they must wear a mask while they are preparing to go home. So in regards to increasing ventilation in a classroom, teachers can certainly open windows to allow fresh air inside the classroom, but we do live in the north, so it is likely that it's going to be quite cold if we're keeping windows open in the class during the winter months. And next slide, Jenna. So I'll hand it back to Raina for question 3.
Sure. So question 3, the newest guidelines put forth by Public Health Agency of Canada is to limit time spent in closed spaces, crowded places, and close contact situations while maintaining physical distancing, hand washing, and the use of 3-layer non-medical masks in all indoor spaces where people are around each other and not members of their household. How is Northern Health and Coast Mountain School District 82 going to implement these changes in our schools? So schools are controlled environments with very solid safety plans and infection prevention measures in place. This truly does help reduce the risk of spread of COVID-19 within the school environment. Schools across the province have been open for a while now, and exposures have occasionally occurred, but the transmission rates by and large have been low. And the same experience has been found in other jurisdictions where schools have been open for much longer than we have in BC. And so I think the most important thing is that, if you're wearing a mask, that the fit of the mask is good, that you're using it properly, you're not contaminating yourself with the mask and the way you put it on and take it off, that you make sure it has a good seal, that it fits correctly and it covers, that you're covering both the nose and the mouth, and that it's got a good seal. And so, 3 layers is better than 2, which is better than 1, but certainly the masks are the very last layer of protection in the hierarchy of control, and the significance of the fit is and putting all of the other more effective measures in place is more critical than the 3 layers. And as we learn more about this, perhaps the recommendations will evolve, and the supply of Health Canada approved non-medical masks will evolve. But I think there's sort of clinical, there's like research, sort of scientific significance, and then there's clinical significance. And so in terms of how significant the difference is in terms of the effectiveness of a 1 versus 2 versus 3 layer mask, I think really at the end of the day, the most important thing at this point in time is that we have really good measures in place, a good solid safety plan, and that it's working really well in the north. And as long as people, when they do need to wear a mask, that their mask is well fitting, and that they're putting it on and taking it off appropriately and not self-contaminating, that's really where our focus should be at this point. So I'm going to ask Katrina to take that, but thank you for the excellent question. And Katrina, I'll get you to take on question 4. Thanks.
Okay, thank you, Raina. So question 4 is looking at the spread of COVID-19 in some of the schools in Lower BC that has resulted in multiple exposure events within the same school. Will siblings be asked to self-isolate if one child in the household is waiting on COVID-19 results in order to prevent the possible transmission to another class or cohort? So no, it's not necessary to keep siblings who don't have any symptoms home from school while one child in the family is waiting for their test results. Most of the time, the results are negative for COVID-19, and we know that keeping children home from school can have significant consequences. We know the public health guidance and current health and safety plans in schools work. There have been a lot of cases in schools in Canada, in BC, and we've also had several experiences in Northern Health. And we know from our experience that in most circumstances, they have led to no further spread in the school setting. The spread is more often being seen in BC, in people living in the same home, and to some degree at social gatherings like weddings and funerals, where people are in close proximity to one another, and they don't have those health and safety plans that schools have in place. So the school setting is not being shown to be a source of a lot of spread, and we need to shift our thinking away from the notion that we can eradicate this virus completely from any environment and be in a zero-risk situation. So there's no workplace or an environment anywhere that is zero risk for anything, including COVID-19. So this isn't a realistic goal. It's all a balance, and we are in this together for the long haul. And our recommendations need to be practical and sustainable. We are really trying to strike the right balance here, and so far it's going very well in the north. And it's also thanks to the amazing job that all of you are doing. So what the schools are doing, the teachers are doing, administrators, support staff, and of course, parents and children and youth. So I'll hand the next slide over to Raina.
Thanks, Katrina. I'm just conscious of time, and I'll just maybe check in with Janet. We did put in a few additional questions from other school districts, and I can certainly speak for myself. I can stay a bit longer, but I am aware that we are running a little bit short of time. So Janet, looking to you to let us know what would be best at this point.
Thank you, Dr. Formerton, and thank you very much, Katrina, as well for your well thought out responses to those questions. I would make the following suggestion, that we table the questions that you're bringing from other districts and add them to our frequently asked question document that we have on our website, and we will be updating in the next several days. I would like to spend the last 2 minutes perhaps with 2 other questions that were late arriving. I knew about them, and one of them is around our cohort or our quarter system. So in our secondary schools, as of this coming Monday, it will be the beginning of Q2, and our cohorts will change. And we very much will be, as we always are, encouraging the use of masks and trying to maintain a culture of mask wearing. We will have new cohorts. The question from this particular person is, will it be mandatory for masks to be worn in class for the 2 weeks after the new cohort has been established? And I don't know if now is the time you wish to respond to that, or do you have any thoughts on that?
Sorry, Janet, is that for Katrina and myself?
Yes. Our intent as a school district is to encourage the students at the beginning, for the first 2 weeks of their new cohort, to be wearing a mask in their classroom.
Yeah, I'm sorry, I'm having some technical difficulties here. Yeah, no, that seems reasonable. I think, encouraging and recommending is great. And of course, there are some people who, for a variety of reasons, medical and otherwise, are not able to wear a mask. And so needing to be respectful of that, and just recognizing again that really, schools are not the driver of our cases in BC and in the north. It's community, it's those higher risk community settings and gathering events and social close contact scenarios. And so so that's really where we're in a fortunate position in North in terms of our case numbers, but we're still trying to ask people, just in terms of their own personal responsibility and their personal lives, to really try to be mindful of the numbers of people that they're interacting with. But yeah, I mean, it certainly sounds reasonable, Janet, that your school district is going to try to encourage, that additional layer of protection, recognizing, of course, that it is sort of the last layer within a whole hierarchy of controls that you've already implemented. And then, of course, I believe you mentioned this would be for the middle and secondary students, not the younger population.
Absolutely. Thank you very much for responding to that. I appreciate it. And the last question is more of a unique question based on unique family circumstances that I might chat with you offline about and respond to the person. It's around caring for an elderly person in the home. So perhaps you and I can discuss that offline. So thank you very, very much. We're about 4 minutes over, but I wanted to take the opportunity to thank both Dr. Fulmerton and Katrina Bryant for joining us this evening and helping us understand exposures, clusters, and how Northern Health will manage when we have an exposure in our schools. And I very much appreciate not only your time tonight, but the fact that as the superintendent of the school district, I feel very comfortable and I feel very well taken care of and very confident in the leadership that Northern Health is showing as it relates to the pandemic. And I want to thank you and your team very, very much for that. And for the last word this evening, I'd like to invite Chair McCrory to conclude our meeting.
Thank you, Janet. And again, extending my thanks as well to Dr. Fumerton and Katrina for your knowledge, resources, and sharing of information. We do feel very well supported by Northern Health, and we appreciate that you are willing to attend these town halls to help people of all of our partners to understand COVID-19 better. And we also encourage students and partners and parents to continue to bring questions in, and we'll do our very best to have them answered and work with Northern Health to have them answered as well. You can also contact, there's all sorts of resources that we will share, and I appreciated the youth resources that were shared tonight, Katrina. That was very useful, and I think we can probably share that on our website as well. And to keep your questions coming if you have concerns, that we as a school district are here to help you navigate through things that you don't understand with the support of our partner, Northern Health. So thank you very much, everyone. And let's all continue to be safe and to work together to keep everyone safe in our communities. Thank you and good night, everyone.
Thank you.
Thank you.